You could be suffering from a small fatty lump that is growing on your body. It could be a lipoma. A lipoma is a slow growing fatty lump that is most often situated between the skin and the underlying muscle. Now, lipomas are usually detected in middle age, but they can present in any age group. Some people have just a single lipoma, or they could have a multiple lipomas can occur anywhere in the body, from your head to your toe. They typically are situated just under your skin. They commonly occur in the neck, shoulder, back, abdomen, arms, and thighs. So lipomas are easily movable and they slightly compress on pressure. They are soft and doughy to touch. Sometimes they can be painful. Lipomas can be painful if they grow and press on or near any particular nerve or a blood vessel. Now, why do lipomas occur? Frankly, there is no associated cause why lipomas occur. They can occur incidentally at any age group to anybody. Sometimes there is a genetic tendency for lipomas to occur. We call this as familial lipomatosis. So these people generally have a familial tendency, and it is a predominant gene that gets activated, where lipomas can occur anywhere on the body. Coming to how do we diagnose a lipoma? Normally, lipoma is a clinical diagnosis. When you meet a doctor, when the doctor examines you, he is able to tell you, okay, this looks like a lipoma. What is the confirmatory diagnosis? You can get an ultrasound scan done to assess the lump, whether it is pressing on any particular nerve or any blood vessel or arising from any deep tissue. Or normally we do something called as an FNAC, or we do a biopsy, where we take out a chunk of tissue and send it for testing. So these are diagnostic tests that help in diagnose. So when do you meet a doctor if you have a suspected lipoma? Let's say a lipoma is red, hot and tender. You have any sort of pain or redness around that lump, and it is causing you discomfort. There is a sudden increase, or let's say the lipoma has been present for a very long time and there has been a gradual increase in size. Any size more than 5 centimeters should get your alarm bells ringing, and it's better to meet a doctor. And then if you have any sort of cosmetic concerns, that is lipomas that are present on the forehead, face, it is better you get it treated and show it to a surgeon as early as possible. Now, coming to what are the treatment options for lipoma. Surgery is the only and definitive option of treatment available. There are a lot of other treatment options that are advocated, like steroid injections and lipolytic injections. Lipolytic injections can be done if it's a very small lipoma, but again, you will require a very large dose and the effects may not be complete, and chances of failure are much higher. Now, surgery, when you come to, surgery can either be done on a local anesthesia basis or a general anesthesia basis based on the size, the number, and how comfortable are you with needle. A small lump that is less than, let's say, 2 or 3 centimeters can be done under local anesthesia as a OPD procedure, where if you have multiple lumps all over the body, let's say 30, 40, you will require general anesthesia and need to get admitted in the hospital to undergo the procedure. Now, for surgeries of lipoma, micro incisions are placed over the lipoma and the lipoma is removed in toto. Please note, previously the surgery used to be with a large incision where you place an incision that is bigger than the lipoma and then you excise the lipoma. But in recent advances, we can make a small opening and we can scoop out the lipoma from within. After the surgery is done, some sutures are placed over the wound for the wound to close. Now, with respect to, let us say, you may have a concern if a lipoma is done on a face, how will my scar be and all that. So, you have good anti-scar creams that can be used after surgery for a better cosmetic result. So, we advise anti-scar creams, especially when the lipoma is done on the exposed areas like the face or even on the hands or arms rather. Now, one more common question which I get from many patients is, can I prevent lipomas? Lipomas that are inherited or familiar cannot be prevented per se. There is no vaccine, there is no pill, there is no lifestyle change that will cause reduction in the occurrence of lipoma. Only option you have is whenever the lipomas are painful or it is looking cosmetically bad, get it removed. So, you may ask whether lipomas can come back after removal. If it's a single lipoma, generally lipomas should not be coming back if they are removed in toto. If some cells are left back, there is a possibility. But in case it's a familial or a genetic issue where you're suffering from, the tendency of lipomas to come back in the same area is also present. Sometimes other lumps can mimic lipomas. So it would be better if you're suffering from any lump to consult a surgeon, get to know what sort of a lump it is, whether it's a lipoma or it could be something else, and then decide on what sort of treatment you want. Please remember, lipoma surgery is not a must and should. It is based on your concerns, or the most determining factor is a cosmetic reason where it doesn't look well. That's why you're getting it treated. And lipomas are not cancer.